Okay, happy Wednesday. Would like to invite you to our PowerPoint presentation as presented to you on behalf of the Sixth House, a nonprofit organization located here in Montgomery, Alabama. And before we get started, I would like to also extend a thank you to Montgomery County Public Library for their assistance in allowing us to present this to you. This is a very timely topic, and hopefully you will learn something from it as we go through it. The title of this presentation is Let Food Be Your Medicine. In the wake of a society that is inundated with chronic illness, especially in light of the pandemic that we are all experiencing at this time, it is so important for us to find ways to improve our health. And one way that we can do that is through the use of food. So as we go through this PowerPoint presentation, there are a few things that you should expect. One, we will discuss why this topic is of importance. Two, we'll strive to define illness and the conditions needed to maintain compromised health. What is needed to keep you sick? Okay? That's a different perspective, a different way of looking at it, but it's certainly important. Three, we will define health and well-being. Four, we will discuss food groups, define superfoods and herbs, and then finally, how to use the diet to improve health. So hopefully these are the objectives that we will successfully cover as we go through this presentation. Now, why is this important? Well, first of all, there's a lot of sick people. If we look at the statistics, the National Health Council reports that there are at least 133 million people who suffer from chronic incurable disease. That means that they have an illness that for some reason we have not found a cure. Now that is to include your common cold. We're not talking about things that we may encounter and it may be minor and get over, but we're talking about things that people suffer from on at least a 3-month period, for at least a 3-month period. The CDC also reports that the 5 leading causes of death, despite the fact that there are 133 million who are suffering from chronic incurable diseases, the CDC is reporting that the 5 leading causes of death are preventable. So if we can prevent this disease process from affecting us, especially in a morbid way, then that's important to discuss. We're going to have to consider that the approach that most of us are most familiar with, which is the westernized approach, it doesn't even offer a cure. That takes us back to why we are looking at this, because 133 million of us are suffering from something that they say is incurable. And then finally, a change in diet and habit prevents and cures the illnesses that we have been told are incurable, not to mention preventable, okay? What is this Western approach? Well, this is probably not an unfamiliar sight to many of us. Whether we are the ones that are having to take multiple medications on a regular basis, or maybe it's someone in the family, but we have all become familiar with that medicine cabinet that is inundated with colorful pills to not remember cure, but just to treat illness. It is so familiar to us. Why? Because about 44% of the elderly population takes greater than 5 pills a day. You've heard that saying, you are what you eat. There's nothing that enters the body that is an innocent passer-through or passerby. Nothing goes into that body that doesn't become a part of you. So if your diet is enriched with pills, guess what? You have become a walking pharmacy. And it's not limited to just our elderly. Our children are taking too many medications as well. Being that I have been privileged enough to serve many of our pediatric patients here in Montgomery, I'm a witness to this. I have also prescribed medicine to children, and it doesn't make me feel good to do that. So what do we do about that? We have to look at the fact that even though we know that there are dangers that are associated with medications, they're used. They are used usually first line. But what are some of these dangers? One, they add acid to the body. And we'll get into why that's an important factor to consider. Two, we're using medications although they cause vital organ damage. Now let me add this. I'm not saying that medications are not useful. I'm saying that perhaps that should not be our first line of defense. Okay? And maybe we're overusing medication. And by doing that, we are creating problems here. Okay? Using medications cause a domino effect. So it puts a band-aid on one issue, but it turns around and creates another issue. Medications compromise the body's defense system and natural processes. For instance, cancer drugs. We're talking about your birth control pills, your hormones and steroids. Every medication that is put inside the body takes the place of an organ's role or function in the body. So if we are adding more hormones than whatever organ or gland is supposed to add to the body, we're creating potential for problem because your body can only take so much. And then another important, essential factor to consider is, as a practitioner, and I can speak on behalf of my colleagues, medications fail to heal. We are taught to assess, to evaluate, and to treat. Assess, evaluate, I left one out. Diagnose and treat, not heal. Despite the dangers, why are we doing this? Well, one, because of the prevalence of disease. We just covered at least 133 million people, okay, have incurable diseases. Two, lack of discipline on behalf of the patient. Now, I have met many in my line of work that want the pill. We want the pill because we know we're not going to do right. When I know that you're not going to behave in a way that you're going to improve your health through your diet or through other means, and really it's not just through diet, you have to look at this in a well-rounded view, okay? Sometimes it could be a lack of rest, a lack of exercise. We have to look at this holistically. But there are many of you that will say to me, nah, I'm just not going to do it. Go ahead and give me that pill. So we prescribe because of a lack of discipline on behalf of the patient. Another reason is a lack of knowledge of all parties. Sometimes we don't know anything else to do. Or you don't know what to tell me. Okay? So it could be just a lack of knowledge of all parties. We may not know that there's another way to combat illness. We are familiar with capitalism. Healthcare is a marketplace. Understand that. Healthcare brings in money. And finally, despite the dangers, despite the organ damage or the possible adverse effects, to even include death, we are not trained to heal. That's the bottom line. We are not trained to heal, but to treat. Now, with all of us suffering from or having the potential to suffer from illness, how do we define this? Illness is a period in which the physical, mental, or emotional state is impaired, and the body and or mind fails to function at its optimal level. So at any point in time, your body is compromised anywhere, that's illness. Now, what is the criteria for illness? That's what we have to consider. Whether it's mental illness or physical illness or emotional illness, there's a criteria for it. One, remember we mentioned that medications add acid to the body. Well, in order for illness to live, it has to have the right environment, just like your plants, just like your animals. Illness has to have the right environment to live. One is acid. Where do we get this acid from? Primarily our diet. It's derived from sugar and processed foods. We're going to go over processed foods in a little bit, but processed means it's not in its natural state. Okay? Two, illness requires salt. You can look at any label on any box, bottle, can, bag, jar. If it's preserved, it's going to have an amount of salt in it. Now, let me say this. We all have to have some type of sodium in the body. It is an electrolyte and is needed. But excessive salt is a problem. So we find excessive salt when we are consuming processed foods that have been preserved. Another criteria is limited air. Anything that prevents you from breathing and prevents you from filling your lungs with fresh oxygen creates the medium for illness to thrive. You're compromised. You're not breathing properly. You're not removing the toxins through the body. Every orifice in the body, whether it's the skin, the nostrils or nares, the pores in the eyes, the mouth, is an orifice, okay? And those are ways that toxins can expel themselves from the body. Well, if you're not breathing, and it's really important that we're able to breathe in a way that we're expelling the toxins from the body, well, they're just sitting there, thriving in this environment that's full of acid and salt. Moisture. Our bodies are comprised of at least 72% water. I've seen it written 80%, 90% water, even though we don't appear to be that way. We are perfect mediums for illness to live and thrive. The COVID-19 virus, any virus, it's not that it wants to take over your body, it just wants to live, okay? So it's going to find a host that has the environment that will allow it to thrive. So if we are full of water, guess what? It's looking for us, okay? Now, how is it that our diet contributes to illness? Where's our dietary choices? When we are making choices as to what we're going to eat, we are making choices as to whether or not we are going to compromise ourselves or we are going to create the medium for illness to live. And not just live, but thrive. What's wrong with this picture? Doesn't it have some lettuce on it? We'll get back to that. When we're making choices and we feel as if we have made some choices that are good for our palate, taste really good, we may tend to overeat, or we may just have a craving for something. But those choices are so important. If we eat too much food, or if we eat food that gives our bodies the wrong instructions, again, nothing just innocently passes through, we can become overweight, undernourished, and we are at risk for the development of diseases and conditions such as arthritis, diabetes, and heart disease. So let's examine that statement. You can be eating properly, but you can eat too much of something. That's a thought. You can eat too much of something. Or you can be eating food that's giving your body the wrong instruction. Every food that goes in your body tells you what its role is. Every food that goes in your body gives your body some type of instruction. Overeating, let's talk about that one first. Overeating will be comprised of an oversaturation of cells. Okay, so even if you're eating properly, if you're eating foods that are in amounts that are considered excessive, then your body has to do something with it. It has to figure out what it's going to do with it. Well, you may oversaturate your cells if they can only hold so much. Imagine how small a cell is. You can't see it with the naked eye. You are filling your cells. We're not filling just our gut. We are feeding our cells. So we have to make sure that we're eating in, when we're considering our choices, we're considering the portion size as well. But definitely, if we're eating the wrong foods, we're oversaturating the cells. So your saturated fats, I know we've heard of saturated, whether it's polysaturated, monosaturated, polyunsaturated, monounsaturated. If it's saturated, it doesn't have enough water. Remember, we are water. We are water, right? So we have to continuously feed our bodies in a way that we're going to maintain its normal state. So we need more foods that offer more water, less fat. That's what saturation means, that it has too much fat in it. When you overeat, you're decreasing your blood flow. Once you think about something, I had a patient before that was eating at Popeye's Chicken at least 3 times a week. He was coming in and having to have regular blood tests done. And he had the highest cholesterol level I've ever seen in my life. Just from his triglycerides. And at another time, we'll consider what cholesterol levels actually mean, because you have to have cholesterol to make your hormones behave in a certain way. But he had the highest level I've ever seen. But let's just say we didn't even overeat like that, or I hate to give Popeye's Chicken a bad name, but it's the fried food. So when you're consuming something that's fried, what happens in the body? Well, we know we're water, so we're going to absorb some of the water, or you're going to expel some of the water. You're going to excrete it even through urination or sweat or something. You might get rid of the chicken, but have you ever tried to mix oil and water? You know that it doesn't mix. So where is the oil? Where do we leave the oil? We leave the oil in our vessels. We leave the oil in our vascular system, which causes a restriction. So your vessels are not able to become flexible as needed, as blood is going through. You're making your heart overwork itself. And something else we don't think about. It goes to every organ in the body. Whatever you eat goes to every organ in your body. It doesn't just go to the tummy. See, once your body breaks it down, it has to use its nutrients everywhere. So that oil is everywhere in the body. So if it's everywhere in the body, and we know what oil looks like when it gets cold, it looks like applesauce. It's hard grease, like lard. Well, that's what's left and deposited in your bloodstream. So you have a decreased blood flow, and you have a number of problems that come from that. You have less leg room for vital organs, which causes constriction in blood vessels, lungs, your liver, your stomach. Again, your organs can't even stretch out and yawn, all right? It also increases in acid, which creates mucus production. Again, mucus creates illness. You all have heard me say that 1,000 times, and if you haven't heard me say that, you hear me say it now. Mucus creates illness, or it signifies illness, because mucus is produced by the body in the face of illness. So if you're eating foods that create mucus, that lets me know that you're eating foods that provide a medium for illness. Overeating also causes intolerable weight bearing on joints. How many of us are going to the physician, we're complaining of joint pain, and we're looking for a pill to resolve the issue? I used to be one of those people. But somebody was very, very honest with me. I needed to lose some weight. So I had to revert back to good eating habits. Before we ever ask for that pill, let's look at ourselves objectively and consider, what is it that my diet is doing to contribute to the problem that I'm having? We'd be surprised. More health risks. This is just a visual for you. When we're overeating, we're becoming overweight or obese, leading to type 2 diabetes. Again, that organ has very little leg room. Your pancreas creates high blood pressure when the heart is meeting resistance, right? Just trying to pump the blood through. That's what it has to do. It's an extremely important organ, but we're making it overwork just from our diet. Heart disease and stroke, because the grease is sitting there in the vascular system. High cholesterol. Gallbladder disease. The gallbladder is responsible for breaking down fats. Well, if we're inundating it with fats, it's overworked. It needs to rest. It's overworked. Some of the fat or the fatty deposits are left in the liver. The liver is extremely important for ridding the body of toxins. It can't do its job because fat is in the way. Joints are affected. Sleep apnea. Some people come in and complain of sleep apnea. I can't breathe when I'm sleeping. I'm waking myself up because I can't breathe. The diet may contribute to that just because we're overeating, okay? And cancer. This was a really neat program to watch, but I would get sick watching them eat. Now I'm not even eating the food and I'm getting sick. Again, wrong foods send wrong instruction. Foods that are not in their natural state, or a food that is not from a natural source, often interrupts the body's natural processes. Let's see if we can understand that one. If the food is not in its natural state, or if it's not from a natural source, then it is interrupting the body's natural processes. The body is going to respond to food. Remember, it's not just innocently passing by. Many of the foods that we eat are not even considered food. So what do I mean by that? We've heard of man versus food. We're going to look at food versus man. Okay? These are some items that we may find in our pantry, and we consider these to be food. These are processed. They are either not from a natural source or they're not in their natural state. And I know that many of these are very tasty. Unfortunately, we can't consider them food. Food versus man. In order for it to be food, it has to be able to reproduce itself. It has to be able to reproduce itself. So this is an example of food, right? This is from your creator or from his natural state, from man. Food versus man. Potatoes, potato chips. Now, I just encountered an experience where I had to explain this to someone. Even some of the foods we consider healthy. Here we see that many of us will call this watermelon. But the difference is it has no seeds, so it's not in its natural state. This has been broken down so many times, broken down, that now it no longer has the life-giving properties that this item has. Just because it doesn't have the seeds. The seeds are extremely important. Extremely important. Not natural. Natural. And when you're breaking it down, you know that you have to be removing the nutrients from it. So now, what is health? Well, health is the opposite of illness. It's the state of complete mental, social, physical well-being, and is free from disease or illness. I didn't make that one up. World Health Organization did. And since we are so accustomed to the Western approach, we really don't know any other means of approaching this. But there are more effective approaches to it. And I don't know if that's going to play for me. But it would play if I had access to it. But this is a video that many of us may have seen already. Believe it or not, this young lady here is in her 70s. She doesn't look like she's in her 70s. But she had encountered illness and decided to change her diet. She started to incorporate a different approach as opposed to medication many years ago. Her husband, on the other hand, is on medication. So this video shows the difference in the approaches, and I really would like to play that. Now, how can we use food as our medicine? Well, food acts as a medicine in that it maintains, prevents, or treats disease. Therefore, we want to strive to let food be our medicine and medicine be our food. And what are the benefits to doing this? Well, it decreases the acid in the body, prevents growth and the proliferation of disease. So let's say you already have a chronic illness. Well, if you change your diet and you decrease the acid, then you are kind of crowding out the neighborhood with some good stuff, right? We're decreasing acid, we are increasing our blood flow, we are increasing the oxygen content, which is necessary for every organ in the body. If you're improving circulation, then you're going to stop the disease from spreading. You're going to stop the proliferation of it, okay? Eating right repairs vital organs. When you are eating foods in their natural state, you are creating the medium for vitality. You are improving the health of your organs. You are infusing them with the nutrients that are necessary to repair. You're reducing what we call oxidation. And an example of oxidation is rust. Just imagine that going on inside the body. When we are eating the wrong foods, we're eating the processed foods that are ridden with metals, ridden with hormones and other preservatives. We are creating oxidation inside of the body. Okay? Not that they look rusty, but they may as well. Those organs are not looking healthy. When you incorporate a healthful diet, your body maintains homeostasis. That's balance. Whether it's mental balance, emotional balance, physical balance, you are creating balance within the body. You're not going from one extreme to the next. The blood sugar is not surging and then dropping. Blood pressure is not surging and dropping. Easy way to keep your blood pressure stable is to maintain hydration, just drinking water. You will maintain balance in the body, the right amount of acid, the right amount of your basics to create the correct pH balance in the body. You're offering more nutritious content. Again, you're repairing cells, tissue, organ damage, and you're decreasing the incidence of disease. Foods from your creator or from its natural source are designed to maintain the body. Again, organic just simply says that it hasn't been altered and no chemicals have been added to enhance the growth, because remember, if it's not organic, then you are still adding impurities into the body. And there are so many foods out there. Again, each food is designed to carry out a specific role within the body. And we hear this all the time, this term superfood. Your acai berry is a superfood. What is a superfood? Superfoods are defined as foods that are nutrient dense. They are organic, they are raw, they have not been compromised or altered, and offer their full nutritional benefit. They're capable of favorably impacting your health. But I say there are no superfoods. And the reason why I say that is because, again, every food has a role in the body. If it's food, if it's organic, if it's in its natural state, it has a role in the body. And each one of them tell you what system of the body they affect most. Most of the foods look like the organs that they treat. Okay? Carrots, when you slice them, look like your eyes, right? The walnut, does it not remind you of an image of the brain? Inside of your lungs are these little sacs, round sacs. Remind me of grapes. Those are called alveoli. They look like grapes. Your tomato has lycopene. When you slice it, does it not remind you of the heart? In fact, I've said it many times before, many of your red foods treat that. Strawberries, beets, tomatoes, cayenne, they're red, they treat the blood. Okay? The ginger, does it not remind you of the shape of the stomach? You have an upset stomach, how many of us have had a ginger ale? Okay, ginger tea, chewing the ginger root. Figs, in our language, just scrotum. Your citrus fruits help to regenerate healthy breast tissue. Sweet potato, pancreas. And the sweet potato is because, and not some of them, but most of them are natural. Okay, I've seen some sweet potatoes I have not seen reproduce themselves, and I grow sweet potatoes. But it offers so much fiber that it enhances the pancreas job because it stabilizes blood sugar. Kidney beans and kidneys. Now, the kidney beans reduce the amount of acid that hits the kidney. That's what damages the kidney in chronic kidney disease. Celery and bones, the mushrooms and hearing, the avocado helps ripen the uterus, especially for women who are in labor. Now, when you're making these healthier food choices, sometimes we kill them just by preparing them the wrong way or seasoning them in a way that we no longer taste the food. We're tasting the salt, or we're tasting the barbecue sauce. Or I can say, hey, I had a salad for lunch, but really I had half a bottle of ranch dressing on my salad. You have now destroyed your food, your decision. When you're choosing your seasonings, you want to choose the seasonings that are enriched with color. So some of your choices would be pink salt. And don't get fooled by the pink salt that's over here or the pink salt that's over there by the bath sauce. This is really the same stuff. You might find it for $1 if you look at it in a place that is not, if it's not in the seasoning section, you might find it for $1. Same salt. Read the label. Your dark brown sugars, you have your coconut sugar or palm sugar, date sugar. Those are natural sugars, okay? And be careful when you're looking at your sweeteners. Many of them are artificial, or many of them have some sucrose that has been added to it, or table sugar that's been added to it. But these are your healthier choices. And salt is still salt. You just have a lower sodium content when you're choosing a salt that has more color. There's even black salt. When you season, again, you want to season with your health in mind. Olive oil is an extremely essential oil to use because it lowers your bad cholesterol and enhances your good cholesterol. Your good cholesterol helps kick out the bad cholesterol. So olive oil, when it's not heated, it is very, very beneficial to the body. So when you're using your seasonings, again, season with your health in mind. Again, when we are preparing our foods, let's say we've gotten to a point now where we are making decisions that reflect healthier choices, our food should look like this. I'm going to step out on a ledge and say, if you're cooking your food longer than 7 to 8 minutes, you've probably overcooked it. When you're cooking your vegetables, in order to maintain their nutritional value, their nutritional content, avoid boiling, because all of the nutrients have seeped out into the water. And do any of us drink that? So you want to choose options that will allow you to cook in a way that you preserve that. One way is sauteing. Another way is steaming. Grilling even. The less that you add to the food to cook it or prepare it, then the better chances you have of preserving its nutritional value. Lemons are also a good way of seasoning food. If you have high blood pressure and you're looking for a way to season your food to make it palatable, to make it tasty, and you're accustomed to using salt, lemon is a good way. Celery is another. But you want your plate to be colorful. You want to make sure that your plate reflects lots of color. Not with ketchup, mustard, mayo, barbecue sauce, but colorful vegetables and fruits, okay? we have a saying. If you do it one time, it may be new. Twice, you may have made it a habit. Excuse me, a hobby. 3 times, it becomes a habit. We are beings of habit. We are beings of routine. How many people do you know that you can say, hey, I know I may not see this person right now, but I can bet you they're doing so and so. And when we get into a routine of doing things as humans, it's kind of hard to change. Making a big life change is scary. But do you know what is even scarier? Regret. Oftentimes we avoid making changes because we don't see the outcome right now. But you may be doing damage to your organs and you don't see the outcome yet. Later you will regret it. And I don't even consider this a big life change. I do consider this a necessity. So why not make the change to be healthy? You want to eat well, and then you'll live well. So will you start today? Before we can ask anyone else to start, we have to start with that person in the mirror. That concludes my PowerPoint presentation. If there are any questions regarding this presentation, feel free to contact any of us at the 6th House. You can reach us via Facebook under our page, Instagram, or you can email us at the6thhouse@gmail.com. Again, thank you for your kind attention, and again, thank you to Montgomery County Public Library.